So here in the U.S., though, case numbers continue to surge. Over the weekend, the country surpassed 11 million infections, and doctors say that they're worried that hospitals could run out of beds to treat patients. Carter Evans reports.
COVID cases are pushing Utah's hospitals to the brink, and things are almost certainly going to get worse, according to Dr. Brandon Webb.
It's almost like watching a slow-motion train wreck. You know what's coming, and it looks horrible.
That's the problem with the mathematics of this, is that we do know what's coming. We're seeing so many cases day over day that unless definitive steps are taken to interrupt the transmission cycle, exceeding capacity is a mathematical inevitability.
Many frontline workers are already stretched thin by work that's physically exhausting and emotionally draining, like Nurse Katrina Emery.
Families are always looking for hope, but sometimes there's just not a lot of hope to give them.
Grim scenes continue to unfold in El Paso, Texas, where county inmates were loading bodies into mobile morgue trucks over the weekend. The county judge there says using inmate labor indicates the city's level of staff shortages. More than 200 people have died in that city from COVID in the last month. With cases and hospitalizations smashing records, at least 27 states have imposed new coronavirus restrictions on businesses and gatherings in the last 2 weeks. On Sunday in Michigan, which saw at least 496 deaths from COVID last week, the governor announced a 3-week freeze on indoor dining and in-person learning for high school and college students.
If we don't take aggressive action right now, we could soon see 1,000 deaths per week here in Michigan.
But without more targeted restrictions, hospital systems nationwide could be just weeks away from their breaking point, according to infectious disease expert Michael Osterholm.
My worst fear is what we saw happen in other countries where people were dying on the streets. People literally were dying in the waiting room of emergency rooms after spending 10 hours just waiting to be seen. That's going to start happening, and we will see the breadth and the depth of this tragedy.
All right, I want to bring in Carter Evans now, joining us from Salt Lake City. So Carter, you know, we have seen this already. This is a lot of what we saw in New York in the early days of the pandemic. So a lot of these hospitals, they know what the potential is, what could be coming. What steps are hospitals taking to prepare for this potential influx of patients?
You know, I think that's one of the hardest part for doctors and nurses is that they're looking at the numbers. They see how many people are getting infected every day, and they know that in a couple of weeks, they're going to see a lot of those people in the hospital. So what are they doing to prepare? Well, they're pretty much at capacity here in Utah right now with their ICU beds. They have a few more, but part of the problem is they just don't have enough people to staff them. And nurses and doctors are starting to get worn out. I mean, this has been a marathon of a pandemic for them. So lately, they've been bringing in nurses and medical professionals from other states to prepare for the surge.
I suppose if there is a little bit of good news, it's that we know a lot more about the virus than we did in March and April when the numbers were spiking. You know, people would spend months sometimes on ventilators. Now I think we've got different therapeutics. Maybe all that time on a ventilator and ICU might not be necessary. But what are we learning about the types of patients that are ending up in the hospital now? We've been told throughout this whole thing that it's the elderly that are particularly vulnerable, that are most likely to end up in the ICU. Who's ending up in the hospital now?
Well, the median age here in Utah is 54 years old. That means there are a lot of younger patients as well. And I've spoken with doctors and nurses who said that they've seen those younger patients. They've had them in their ERs, they've had them in their ICUs, and they've had them pass away. They say this is a disease that does not discriminate, and that's why they are so concerned about the upcoming Thanksgiving holiday, because you just don't know who in your family could be affected by this if they get it. And that is the big scary thing right now. This is not just older people. It does affect older people more than younger people, but it can kill younger people as well.
And so we have sort of a little bit of good news. Moderna says that they have a vaccine that's, more than 90% effective in phase 3 trials. Last week we heard about Pfizer. Now we just sort of have to emphasize that this reporting, it's coming from the drug companies. It's coming from the pharmaceutical companies making these vaccines. So, it has to be reviewed, but things look promising. Any reaction on the ground there, hearing the news of these vaccine developments?
They're hopeful. They're hopeful. 94% effective rate, 94.5%. If that's accurate, that's real good news. I understand these vaccines are already under production. Distribution is going to be the issue, getting them out to people in time. So while they are hopeful here with this news of a vaccine, they know it's still a long time coming and they can't count on it. And then there's the issue is, will people take it?
Yes, indeed. And, with at least the vaccines that we're looking at now, they need to be kept very, very cold. It's a double dose before it's effective. So, yeah, there are a few sort of little bumps there that we'll have to navigate. Meantime, you've also been sort of keeping track of the economic impact that the pandemic is having. Over the weekend, we saw this unbelievable video of a food bank in Dallas with cars lined up. It looked like, for over a mile. What was happening?
Yeah, if you thought that this pandemic and its economic impact may be coming to an end because of the holidays, that is certainly not the case. And a look at the line for this food bank outside of Dallas is a prime example. They gave away food to 25,000 people. That is the most ever for them. But imagine 25,000 people in line for free food just a couple of weeks before Thanksgiving. We've got a long way to go here.
Carter, it breaks my heart. Many of those people, I'm sure, never thought they would go to a food bank. Many of those people probably donated to food banks in their lifetime.
Yes.
So yeah, it's tough. Carter Evans, thank you so much.
Sure thing.